Hello, this is Talking Europe on France 24. I'm Catherine Nicholson. Now, here in Northern Europe, it is the summer. Hundreds of millions of Europeans have been vaccinated against Covid-19. So you might think a more normal holiday season was on the cards. But it all depends on the state of the pandemic, of course. And attitudes around the continent to opening up to travel again vary from the highly keen, like Greece, to the greatly hesitant, such as Finland. And it's not just about taking a break. A huge chunk of the European Union's wealth and jobs are created by the tourism industry. What's more, free movement is one of the most fundamental freedoms guaranteed by EU membership. Well, today we're speaking to the doctor who heads up the agency, which provides a lot of the statistical analysis that politicians and the rest of us are looking at to make decisions on all of this. Dr. Andrea Ammon, Director of the European Centre for Disease Prevention and Control. Thank you very much for being with us.
My pleasure. Good morning.
Well, let's just start off with a look at the state of the pandemic right now. The numbers have been fluctuating in various member states of the EU and EEA. What's your assessment of where we are?
Well, in general, what we're seeing is a declining trend of case notifications and of death notifications. But on the other hand, we also see that variants are taking their place. And we have now, as a kind of counterbalance, increasing vaccination rates. However, they are still, it's about 46% of the population that have one dose and 22% of the population that have a double dose are fully vaccinated. So it's still not enough high part of the population that is actually vaccinated.
And as a doctor, are you satisfied that the vaccination campaign is advancing quickly enough around the European Union?
Well, what we see since several weeks is that it's steadily progressing. So we see progress every day, which is very good. So people are being protected. Now, what we also see is that in some countries, there is now the availability of doses, but not enough people who want them. So what we will be facing is that we have to really now try to reach those people that have maybe doubts of getting a vaccine.
And of course, Europe very much not an island in this pandemic. It's by definition affects the entire world. The World Health Organization has repeatedly called on richer countries, including the EU states, to do more to get the less wealthy countries of the world vaccinated. Is that a priority in your eyes as well?
Well, this is, of course, a decision of the countries to see. On the one hand, they have to take care of their own population, but of course, there is also a wider responsibility, and how to balance that is really a decision of the countries.
You mentioned just before about variants of coronavirus that are causing concern. There has been a lot of concern about some new variants that could throw the health recovery off track. Which ones are the most worrying right now?
Now, the properties of variants that are of concern is if they increase the transmissibility of the virus, the severity, or the effectiveness, reduce the effectiveness of the vaccines. So far, the variant that is most spread in Europe is still the now called Alpha. That is the variant that was first detected in the UK. And now we are seeing the Delta variant that is the from India that is taking more space. The other two variants, that is the one that is coming from South Africa, or was first detected in South Africa, and the one first detected in Brazil, they haven't really increased much in overall in Europe, although there are localized clusters. what we have right now is that the alpha variant and is more transmissible, but it seems that the current vaccines are covering it.
Yes, and that's obviously something that's still being studied and closely looked at. In terms of vaccines, France among the countries that's talking about vaccinating some under 18s. Is it possible to predict what difference it would make to the spread of infections if, say, 12 plus were vaccinated as well?
I mean, we have published recently some considerations on this, and the effect on the overall pandemic will really depend on how much these age groups between 12 and 18 are really contributing and driving the pandemic. So the more this is the case, of course, the more effect it will have vaccinating them.
And currently, it seems that the lowest age anyone's talking about is 12, if I'm correct. If the under 12s aren't vaccinated, then surely this virus will actually keep propagating and keep mutating.
Well, I mean, that is something that is part of the overall considerations. So far, younger children have not been affected much, as much as elderly in the pandemic. But of course, if they are the only susceptible ones, then that might change.
All right, of course, something that will be looked into in the future. Now, as I mentioned in my introduction, there's a lot of thought about travel and summer holidays. It feels right now like travel in Europe is probably more complicated than it was last summer. Need to get PCR tests, show proof of vaccination. There's definitely more paperwork involved, I think we can say. Just in terms of stopping the resurgence of the pandemic, is it right that people should be travelling relatively freely around Europe, or should there really be restrictions in place?
Well, I think that depends on your own status. I mean, if you're fully vaccinated, then of course it's easier to travel without restrictions. But if you're not or have only one dose, then I think in order to reduce the risk of transmission during the travel, the testing is a way to do it. And in order to make sure that during the stay in a country you are not becoming infectious or coming as an infected person into the country, a quarantine is also a way to prevent that. Of course, it doesn't prevent then the infection in the country, as if the virus is still circulating. But that is then the measures in the country that should be in place.
Now, it was recently announced that your agency, the ECDC, is going to join forces with the European Medicines Agency on monitoring the safety of vaccines. Can you tell us more about what that will involve?
It is a joint venture with the Medicines Agency and our agency to monitor safety and the effectiveness of vaccines in real life. So the Medicines Agency is looking at the safety, and we are looking into monitoring the effectiveness of the vaccines in different subpopulations. And this is an infrastructure that we are now setting up for, and will soon start collecting information on this.
In terms of these kinds of initiatives, we on France 24 spoke recently to the EU Ombudsman, Emily O'Reilly, and she said that she believes that the ECDC perhaps hasn't been given enough powers or resources in some areas when it was set up. For example, in terms of the right to demand data from member states. Would you be seeking to have greater powers, expanded possibilities such as that?
Now, regarding powers to demand or tell the countries what to do, that is a principal division of competences between the EU and the countries in the area of health. And I think unless the of the EU are changed, there will be no change in this. Regarding the resources, this is indeed the case that we have been struggling to meet all the expectations and demands that were now posed on us in the past 1.5 years. And here the legal proposals are foreseeing extra resources. They are also foreseeing a clearer mandate for supporting the countries with preparedness, supporting the countries with modernizing the infrastructure and systems for surveillance in terms of more digitalization, and also to be more active globally.
Just time for one final question. Are you predicting another wave of this infectious disease coming back to us this autumn, this winter?
I mean, that will largely depend on how we behave during the summer.
And so what would you advise people to do?
Yeah, for us, it's really that the vaccination should be accelerated as much as possible. Countries should have an infrastructure to test and trace any contacts. That includes sequencing so that the variants can be monitored, and to keep certain measures in place like the distancing and the mask wearing.
All right, well, we'll have to see how the summer pans out. Thank you very much for now, though, Dr. Andrea Ammon, head of the ECDC.
It was my pleasure.
And thanks to you for watching the programme as well. Hope to see you soon on France 24.